Hi, my name is Dr. Sindhu Lohana. I'm practicing as a specialist pediatrician at NMC Medical Center, Buhairah, Sharjah. Today we will be talking about influenza virus infection in children. Influenza is a contagious respiratory illness which primarily affects nose, throat and lungs, and it is not same as common cold because influenza tends to be more severe and can lead to the complications, especially in the younger children. There are 4 types of influenza virus: A, B, C and D. A, which is most common and can lead to seasonal epidemics and pandemics. There are subtypes of the A also. B primarily affects the children and can lead to the seasonal outbreaks. C is clinically insignificant and very rare. D primarily affects the animals. Now, how it is transmitted to children? It's basically the transmission is through the respiratory droplets when the child is coughing and sneezing, and it can also transmit through the contaminated surfaces and hands. And children are more vulnerable because of their immature immunity system, and they are going into the closed spaces like daycares and schools, and their viral shedding time is also more prolonged than the adults. So generally influenza presents with sudden onset, high-grade fever more than 39 degrees Celsius, and fever can be associated with sweating and chills, body aches, weakness, tiredness, sore throat leading to pain and refusal to feed, runny nose and nasal congestion, and poor appetite is very common, and headache can also be there in the older children, and sometimes it presents with gastrointestinal symptoms like diarrhea, vomiting and abdominal pain. The younger infants like less than 1 year old can present with poor feeding, lethargy, they would be irritable, and it can lead to apneas also. Generally, influenza is diagnosed via the clinical condition and then some laboratory testing. When the child is coming to us in the flu season with sudden onset of high-grade fever, cough, runny nose, and there is positive family history of influenza in the family or in the surroundings, we do test in the clinic as a rapid antigen test. We take the nasal swab and the result would come in 15 to 30 minutes, but the sensitivity is very less for this test. When the child is hospitalized, RT-PCR is the gold standard, and which has a very high sensitivity and specificity. Viral cultures we are not doing usually because it takes longer time for the results. So influenza is usually managed with supportive care, and sometimes we are giving antivirals also. In supportive care, we offer paracetamol or the ibuprofen for fever, and we advise for the good hydration, good rest, and sometimes nasal sprays are used for the runny nose and nasal congestion. Antiviral comes with the name of the Tamiflu. Basically, the generic is oseltamivir, and usually it's given within the 48 hours of the onset of symptoms. Then it reduces the severity and duration of symptoms, it prevents the complications, and after the age of 2 weeks we can give Tamiflu. And if the child is having a severe respiratory distress, dehydration or any complications, we refer the child to hospital for admission. Yes, influenza virus infection can be prevented by giving annual influenza vaccination, and it should be given after the age of 6 months and before the age of 9 years. When you're starting the vaccination, it should be 2 doses, 4 weeks apart, and then every year 1 influenza vaccination shot. And it's available in the IM, which is inactivated, and live attenuated in the nasal spray form. And then you have to prevent the spread of infection by asking your child to follow the respiratory etiquettes when they are coughing and sneezing, and how they should hold their hands on when they are coughing and sneezing, and there should be hand hygiene practices, and they should not go to the school and the daycare when they are sick. And some high-risk children should be offered oseltamivir prophylaxis when somebody in the family or close contact is positive for influenza virus. So my take-home message for the parents is that Influenza virus is not just as common cold. It's a serious virus illness and it spreads easily among children and adults. So we can protect with vaccination, practice good hygiene, and notice the early warning signs. So with early medical care, we can save the lives. And if you have any queries and if you want to vaccinate the child, you can consult me. I am available at NMC Medical Center, Buhairah, Corniche, Sharjah.